Yeah.
And I see a question about manual extraction. Is it better than motorized extraction?
Yes, I was going to ask you that.
You know, people focus more on the tool than the person who's conducting the operation.
Yeah.
If they give you a manual extraction, if you care less about what you do, you destroy. The motorized has added another dimension because now it's in the hand of anyone who think that they can just take a punch and harvest hair. The key is not the machine. The key is the person who's doing it, how they respect the donor. Do they have a harvesting protocol? How many hair they leave behind? That's the key. If you take everything close together, you create a lot of scarring, you disrupt a lot of blood vessels, so the healing will not be optimal. The remaining follicles will not get enough blood supplies, they will shrink, so you have some miniaturization post FUE. That's what we're seeing now, because people are going to those clinics where they just want to harvest your hair regardless. You know, they may have 50% transaction rate, but they're still harvesting.
Yeah.
Because they have to reach a certain number. And that's the problem with the market today. Is not the motorized tool the problem, is the ethic, is the people who are doing it, and that's exactly what's at stake. Is not the tools. So people should not starting debating about tools and all that, because at the end of the day, when you look, there are a lot of punches on the market. Some will say, yeah, I'm using 0.8 millimeter punch, but when you look at the hole, you know that that hole is 1.2. I laugh a lot when I look at the forum and pictures, and
Yeah.
because if you use a low quality punch where the inner diameter and the outer diameter, then you have the thickness of the wall. So the cheaper the punch, the greater the thickness of the wall, because they have to use the big steel.
Yeah.
So then the whole, that maybe the inner diameter may be 0.8, but the outer diameter and the thickness of the wall will make it a 1.2, 1.3. And then when you put it close, you're just destroying surrounding tissues. That's really the problem.
Thank you so much for watching our videos, and for more great content, don't forget to hit that subscribe button, and also go to www.bhrclinic.com and start your journey for a free assessment with Dr. Bisanga. Thanks ever so much. Let's get started together, and look forward to seeing you soon.